Joining me today is Dr. Arthur Mark, orthopedic surgeon from our friends at Seaview Orthopaedics. Dr. Mark, thank you for joining me today.
Thank you very much for having me today.
What are the most common types of joint replacement?
Today in the United States, the most common joint replacement is actually a knee replacement. And the second most common is the hip replacement. These two joint replacements make up more than 90% of all the joint replacements done in the United States today. The less common joints that still can be done are elbow replacements, ankle replacements, and wrist replacements. But knees and hips make up the majority of the cases.
Why are joint replacements needed?
Joint replacements are needed when people have usually what we call end-stage arthritis or damage to their joints, in which they get so much pain that their normal walking becomes very difficult and painful.
When does someone need to seriously consider a joint replacement?
It's thought that when you need a joint replacement is when your normal day-to-day activities become very difficult for you to do. And this can vary from person to person. I have a lot of younger patients in their 40s and 50s that are very active and like to still do things like play tennis or ski. And those patients like to see me a little earlier when they have so much pain they can't do the activities that they enjoy. Some of my other patients, when it gets very difficult to do their normal things like walking a block around the yard or taking a walk along the beach, when that gets so painful, then it's time to really consider whether or not a joint replacement is the right answer for you.
And what is the average age of your patients?
Today, as an orthopedic specialist and doing only joint replacement, my average age is probably in the 60s. I have a lot of young patients down to 20s that have either congenital problems or had some kind of disease like cancer that injured their joints. And I do them all the way up into patients in their 90s that are in good health.
I imagine you have a lot of patients here at Seabrook.
Yes,
I know you do. Explain the procedure for a knee and a hip replacement.
I'll start out with the knee replacement first because it's much more common. A knee replacement today is done usually in a hospital. I work at many hospitals in this local area, but most of my cases are done at Jersey Shore University Medical Center. It's usually a 1 to 2 hour procedure. It requires a 3-day hospital stay. You have an incision, and we talk about resurfacing the knee, which is actually cutting away the damaged arthritis and inserting a metallic implant. This implant is typically made out of either titanium or stainless steel, and the implant is actually cemented onto the bone. Once this is accomplished, you can walk now on your bone and no longer have the damaged cartilage which was giving you all the pain.
I'm sorry, go ahead.
For a hip replacement is very similar. The hip replacement is a ball and socket joint, and the ball and socket is actually removed. We put a metal stem into the hip joint, and then we put a socket into the pelvis part or the socket part of the hip. This is also done through a pretty small incision today, about 4 to 5 inches, and it's done in approximately an hour to an hour and a half.
Oh, that's rather quick. In my own family, someone this week just had a knee replacement.
No.
Is there anything to do before the surgery to make it more successful?
Yes, there is. If you keep your muscles strong around the joint that we plan to replace, for example, in the knee, keeping it flexible, stretching it out, and having a better range of motion before the surgery will help with the range of motion after surgery. In addition, the better your strength is before the surgery, the better it is afterwards. So doing exercises and keeping your joint limber before the surgery is helpful for your overall outcome. In addition, if you can keep your health good and keep your weight down, that will also speed up your recovery after a joint replacement.
What can you expect after the surgery?
The recovery for a joint replacement is relatively long. It takes about 2 to 3 months before you get back to your normal activities. Typically, my patients stay in the hospital for about 3 days, and then they go to a rehab center for about 1 to 2 weeks. The rehab centers such as Renaissance Gardens here, we transfer you there and where someone can help you do physical therapy for a few hours a day. Then you transition back to the home and do some more physical therapy for anywhere from 4 to 6 weeks. And then most people by 2 to 3 months are doing all their normal activities again.
What are some of the risks for complications after the surgery?
Well, the big risk that we worry about after joint replacements, of course, there are infections. Infections are very rare, but when they do, they're a pretty devastating complication. Hence, we take a lot of care in preventing the infection using preoperative antibiotics, using antibiotic scrubs. These are all things that we do today to kind of improve the chance of you not having an infection. The other major complication that we worry about is DVTs or blood clots. You'll be put on blood thinners after the surgery for at least 2 to 4 weeks to prevent the complication of a blood clot. And lastly, the other things that are inherent to any surgery is blood loss and stiffness. For the blood loss, I'm a big fan of using some kind of cell salvage or a cell saver machine, trying to return your blood back to you after the surgery. We kind of save any blood that you lose at the time of surgery and give it right back to you. In addition, there's medications we can give you now to boost your blood count before the surgery.
Talk to us about the rehab experience for joint replacement patients.
Joint replacement patients in my practice are by far the most happy patients when they're all done. The knee replacements are a little bit more painful and more difficult to rehab than the hip replacements. Like I said, typically the stay in a rehab facility after the hospital is about 7 to 10 days. So most patients are back in their homes within 2 weeks' time. The things that we do now for pain afterwards include nerve blocks. You know, we can do epidural type of anesthesia and pain pumps, and all these things have decreased the pain with the knee replacements. For the hip replacement patients, I think the rehab is a little bit easier. It's not quite as painful, and for them, it's a little bit opposite. There's things that we call hip precautions, certain positions you shouldn't put your hip in for the first 2 to 3 months after the surgery, and that's to help the muscles heal up before the final process of doing all your normal activities again in the future.
And I assume after rehab facility, patients can use our own physical therapy department.
Absolutely. After they go to inpatient rehab facilities such as Renaissance Gardens, most of my patients here at Seabrook go to the outpatient facility out at the Village Center, the medical center.
It's directly across the hall, matter of fact.
Okay.
Is there a high level of pain following the surgery or during the rehab period? You generally mentioned that already.
Yeah, there is a moderate amount of pain. We do give pain medications for this, but most people after 1 or 2 weeks notice a dramatic improvement in the pain after the surgery than they had beforehand. In fact, some of my hip replacement patients the next morning can't believe that the pain is gone when they get up and start walking.
I've been surprised to see some of the patients that have had hip surgery come back here so quickly and be right into the norm of things. Can someone expect to participate in a full range of activities after recovery?
In my practice, I don't limit what patients can do after surgery. You can do whatever activity that you enjoyed before surgery. There's really no limitations. I tell patients that if they want to play tennis or ski, things like that, if they've done it before the surgery, then I would be happy for them to do it again. I wouldn't pick up any sports that are dangerous like skiing if you've never done it before, but...
not too many here.
Yeah, but I mean your normal activities of just playing tennis, walking, riding your bike, things that you enjoy, those things you can all do again after the surgery.
So you can go back to the fitness center quite quickly then?
Absolutely.
How long do artificial joints last? Would one ever have to have additional surgeries?
Artificial joints today have come a real long way. They've been around since the early 70s, and over the last 40 years, they've really developed to be something we can do consistently and last a long time. I can pretty confidently say most joint replacements today should easily last 15 to 20 years if they're put in properly. Usually, if you don't have any problems in the first 2-3 years, it's very unlikely that you're going to have any long-term problems. If your joint replacement does wear out, or you unfortunately are one of these people that get an infection or break your bones around the joint replacement, there's always procedures that can be done, or revision, a redo hip or knee replacement. As a hip replacement specialist, this is what I specialize in. I do a lot of what we call revision or redo hip and knee replacements. If the joint has worn out, or if someone got in an accident and broke their knee replacement, these things can be done. So you can't think of it as that once I wear out my 20-year-old knee, then there's nothing left for me. There's always options for patients.
What can you tell me about recent recalls on hip replacements?
This is a really good question. This has been in the news very recently. There was a company, Johnson & Johnson DePuy. DePuy is a subsidiary that makes all the orthopedic implants for Johnson & Johnson. Just recalled one of their hip replacement implants. This is something that all companies do. Unfortunately, the United States doesn't have a joint registry, but in Europe and in Australia, they have joint registries, and they follow these patients. When they notice that one implant is not performing as well as the other, they usually take it off the market. The socket that's used, that Johnson & Johnson recalled, is a very unusual socket, and it's very rarely used in the United States. It's less than 1% of all patients. It's a solid piece metal-on-metal hip replacement, which is one of the newer technologies out there. So 99% of the patients that get hip replacements, even from Johnson & Johnson, do not have this hip. The best thing to do is to call your doctor, but don't be alarmed. Unfortunately, the lawyers are putting out a lot of emails and television ads and newspaper ads to look for people that have these implants. But overall, it's a very, very rare thing.
Tell me about some of the advancements made with artificial joints.
The advancements today mostly are in the last 5-10 years are the way that we do the joint replacement. Minimally invasive surgery has really changed the recovery of the patients. They do a lot better in the first 2 to 6 weeks. Long-term recovery has really not changed. The other big changes are some of the bearing surfaces. There are now ceramic coatings, there's ceramic hips and metal-on-metal hips. But unfortunately, some of these new technologies don't pan out. Like I said earlier, all these recalled devices are actually what I consider newer devices that have been introduced to the market less than 5 years ago. So if the surgeon says this is a hip replacement that's been used for 10 to 20 years, it's probably a really good one because it hasn't been changed.
Is there a point in time when waiting too long makes joint replacement an unavailable option?
That's also a very good question. There are a small group of times where your what I would call your deformity, if your leg gets so crooked or your hip gets so stuck or worn out that it makes the surgery technically more difficult, then sometimes you get to go to a specialist like myself to do the hip or knee replacement. There are almost no hip or knee replacements that we can't do. Sometimes if you have an existing infection or a chronic infection, then a joint replacement is not an option. And the other time, which I talk to a lot of patients, is if your overall health is not good. If your heart and your lungs aren't good and you can't take the surgery, then unfortunately then the options aren't good for you for undergoing anesthesia for the procedure.
I'm a diabetic. How does that affect the need for surgery?
That's also a very good question. Diabetics are very common today in the population. I'm sure you know a lot of diabetics. If your sugars are well controlled, then there is no reason why you cannot have a joint replacement. But if your sugars are not controlled, if your hemoglobin A1C is very high, then it makes you increase risk of poor wound healing or infections in the future. So these are things that I talk to you and your medical doctor about to try to control and make better before the surgery.
Dr. Mark, thank you for joining me today, and thank you for watching our program. Please join us again for the next edition of To Your Health.